Imagine if the world around us started to become unfamiliar, not because it has changed, but because our mind has. This is the reality for millions experiencing dementia, but is often misunderstood. Dementia is not a single disease. It is an umbrella term that encompasses a decline in mental function severe enough to interfere with our daily life. It compromises memory, thinking, orientation, comprehension, calculation, learning capacity, language, and judgment. The World Health Organization recognizes dementia as the 7th leading cause of death worldwide. According to the Dementia India Report 2020, more than 3.7 million Indian people aged over 60 have dementia, with numbers expected to rise. An article published in The Lancet by Professor Gil Livingston and colleagues from the UK Dementia Research Institute in July 2020 estimates approximately 50 million global dementia cases, projected to increase to 153 million by 2050. Symptoms of dementia can vary, but often include memory loss, communication problems, depression, anxiety, and difficulty in recognizing familiar places and faces. Some may experience hallucinations, loss of coordination and motor functions, and so on. There are several types of dementia linked to specific kinds of brain cell damage in specific brain regions. Diagnosing different types of dementia typically involves a combination of medical history, cognitive assessments, neurological exams, and sometimes imaging tests like MRI or CT scans. It is essential for doctors to consider various factors and patterns of symptoms to make an accurate diagnosis. Alzheimer's dementia is the most common type of dementia. Alzheimer's disease causes shrinkage or atrophy in the posterior part of the brain. The presence of abnormal deposits of proteins termed the amyloid plaques damages the brain cells. This dementia typically affects those over 60 years. Vascular dementia, caused by disrupted blood flow in the brain, also prevalent in the older populations. Lewy body dementia, identified by protein accumulations called Lewy bodies in the brain cells, poses a higher risk for those above 60 years. Frontotemporal dementia affects the frontal and temporal lobes of the brain, which results in changes in personality and behavior. It often begins between the ages 40 and 65. According to Professor Gil Livingston and team, it is possible to reduce the prevalence of dementia up to 40% if proper actions are taken to limit the potentially modifiable risk factors. These risk factors include hearing loss, traumatic brain injury, hypertension, high alcohol consumption, obesity, smoking, depression, social isolation, physical inactivity, diabetes, air pollution, and less education. Remember, dementia can have various causes. Dementia's impact is multifaceted: physical, psychological, social, and economic. Early diagnosis and appropriate management are crucial for improving the quality of life for individuals with dementia. A recent paper published in the journal Alzheimer's and Dementia in February 2024 from the NIMHANS, National Institute of Mental Health and Neurosciences, Bengaluru, reports that compared to monolinguals, older people who live in socio-linguistically diverse societies and frequently speak 2 or more languages have a lower prevalence of dementia. Understanding dementia is the first step towards compassion and support. So let us join hands to create a world that cares for the minds that once cared for us. Thank you.